The next, Dr.
Prateek Nishant.
Prateek Nishant and Dr. Anjit Paul. Please come here and stand.
Esteemed panel, ladies and gentlemen, good morning. This is a very brief presentation on traumatic scleral tear with lens back complex extrusion. We were just talking about the pseudophacoceal, and this is a complete lens back complex extrusion, and somehow the patient recovered good vision. So no financial disclosures. To introduce, injuries to the globe are commonly seen in road traffic accidents, and there are many cases reported wherein the phacoceal is found. The post-traumatic subconjunctival IOL dislocation is also found, and herein we are reporting one such case. So a 53-year-old male presented with pain, diminution of vision and inability to open the eye for 3 hours following the trauma with the rear view mirror of his motorcycle, which was hit on the rear by a truck. So this was in the peak of the first wave of the COVID pandemic. On general examination, the patient was stable. On ocular examination, the vision was pH positive with an inaccurate PR and with a complete ptosis with watery discharge and blood clots. A translucent globular mass was seen in the conjunctival sac with nasal bulbar conjunctival laceration with an occult underlying scleral laceration. So this is the anterior segment photograph of the patient. And the anterior chamber was deep. There was total hyphema and 4+ cells and pigments with complete aniridia. The patient was aphakic. Definitely we can see the translucent globular mass, the lens back complex, which spontaneously fell out as well as soon as we opened the eye. And this is the photograph showing the aniridia and the aphakia. So right eye scleral perforation with traumatic lens back complex extrusion, complete aniridia and complete ptosis. It was managed by scleral perforation repair under general anesthesia with GVP done within 6 hours of the presentation. 12 to 13 millimeter concentric nasal limbal laceration was noted. No vitreous loss was noted. The AC wash was done. The scleral wound was closed. So this is the 11 millimeter nasal scleral laceration, which was sutured. The conjunctiva was closed with 680 vehicle, and the AC wash was done, and the air bubble was retained. So post-operatively, antibiotic steroid and atropine was given. Recovery was uneventful. Intraocular ophthalmoscopy revealed hazy media, which gradually improved. Yes, sir. And he was observed. At last follow-up at 2 months, the BCVA improved to 624 with aphakic correction. There was slight improvement in ptosis, and unfortunately, it was lost to follow-up in the first wave of the COVID pandemic. So myriad consequences can be there, and the limbal laceration can be explained by Art's theory, wherein the sclera undergoes greater stretching at the point opposite to the impact and ruptures at the summit of this stretching. So in the exhaustive literature search, no report was found in which the lens back complex was extruded with complete aniridia and complete ptosis together. Phacoceal and pseudophacoceal, of course, have been reported, but in our case, the lens back complex was lying on the ocular surface and fell up spontaneously. So this happening in a previously normal eye is a rarely encountered scenario, and fortunately this patient recovered good vision due to early intervention and identification of the problem.